Okay, so I'm getting texts and messages of people wanting to know where this live stream is happening. We usually live stream Coffee with the Critters on via Facebook due to several different reasons. We've chose to do this through Zoom, and people had to click on the link in the event section, register, and we're going live in Zoom now. We're here with Dr. Amy Hopkins. For people that may not be familiar with the work I do, my name is Laura Joseph. I'm owner of the Animal Behavior Center. We're an international educational center where we empower animals and the people that care for them, and then we do that through our live streaming services. If you'd like to know more about the work we do, you can find that on our website at theanimalbehaviorcenter.com. Okay, and it is an honor for me to bring to you Dr. Amy Hopkins. People within the Parrot Project are familiar with you. I'm sure many people are familiar with you, but we live streamed with you in the Parrot Project probably about a month and a half, 2 months ago. So as we get started, let me, first of all, Dr. Hopkins is going to talk for 10 to 15 minutes. As you guys have questions, because we have everybody muted, type them in the chat section. And I'll keep my chat section open and pay attention, but that's where you can ask questions for Dr. Hopkins. Before we get started, I'm going to go ahead and read you her bio so you know who you are listening to. Dr. Amy Hopkins is a Connecticut physician who trained at Yale for both internal medicine and occupational and environmental medicine. She also has a master's of public health and a PhD in biophysics. As a scientist in environmental medicine, she focuses on the interactions between humans and their environment, including other animals. She has previously co-authored environmental health technical guidelines for the Peace Corps to use in undeveloped countries. She has the good fortune to be companion to 3 wonderful birds, 2 cockatiels and a galah, not to mention an elderly turtle, and is also an avid bird watcher, both locally and around the world. She is president of the Parrot Club, Connecticut's oldest companion bird club. She is also a licensed wildlife rehabilitator and has worked with both songbirds and raptors. As both a physician and a lover of all things avian, she is very interested in the health effects of our interactions with birds. So welcome, Dr. Hopkins.
Thank you so much, Lara, and thank you, everybody, for taking some time out of your Sunday afternoon. Of course, I think most people are home right now, so it probably isn't a big stretch. So we're going to talk about a variety of things today, and I obviously have to put a disclaimer at the front. I'm not a veterinarian, and if you have questions, obviously call your veterinarian, anything related to your pets. But having said that, I want to go through some things that are going on now, obviously with COVID-19. And right off the bat, the very first thing I want to say, which is really, really important, not just in the United States, but all around the world, because there's a lot of misinformation that you're going to be hearing out there. I urge everybody, please do not listen to your politicians. Politicians are not scientists. Lara's going to post some resources, but there are lots of great places to get accurate medical information. The CDC, the World Health Organization. For animals, there are a couple of links that we're putting up for the American Medical Veterinary Association, and there's also some really good information on the Petco site, and we'll be talking about those things as well.
And I'm posting those links in the chat box right now.
Okay, fantastic. Oh, you know what? I need to see the chat box. How do I bring the chat box up? That's a good question.
I know what it looks like from my screen.
Yes. Oh, wait a minute. I can click on. Oh, there we go. I got it.
Okay.
Yes. I see. All right. Right. Because I don't think you can see anything before you open the chat box. So I encourage everybody to open the chat box and maybe post it again at the end, because like for right now, I can't see what you already posted.
Okay.
Okay.
Oh,
right.
I'm posting it privately. Okay. I'll figure out how to post it publicly.
Okay. Okay. Oh, I'm sorry. My birds are going to be singing, but I think everyone there who has birds knows that. Tulip. That's kind of hopeless. Okay, so just circling back around to that again, politicians have different agendas from scientists. So some politicians are going to underplay things because they don't want to start a panic. Other politicians are going to overplay things because they want to draw attention to things. Please just don't get your scientific news from the politicians in the United States or any place in the world, because they have different agendas. There's just been a tremendous amount of misinformation out there from our politicians. So that's all I'm going to say about that. Go to reputable sources. Is that too loud? Is he making too much noise? Or, okay.
Not at all.
Okay, good. If you're in the United States, by the way, a really helpful source of information locally, because you can get all the information you want for the country from, again, CDC, WHO, Harvard, Johns Hopkins, Cleveland Clinic, Mayo Clinic, all the reputable scientific sources. But one thing I've found really, really useful, nothing to do with animals, but most communities in the US have something called Patch. It's an online service, and every day they email you local news items with links to the items locally and in your region. Now, of course, with this going on, I've been getting this probably 2 or 3 times a day. It's really useful because they'll tell you things like what schools are closed, what community activities have been called off, which stores are open or not open, things like that. So if you're not subscribed to Patch, I would set that up. It's free and it's easy, because it's really been sort of a lifeline for me every day to know exactly what's going on in my town, in my county, in my state.
And Dr. Hopkins, I'm sorry, I'm still sitting here putting in.
Oh yeah, I see your post. Patch.com.
Okay.
You can put that up to www.patch.com. So, and whatever sources you have in other countries, I know we have people from other countries that are logged in as well. But it's really important because news is changing every day with these things, and what they say one day may not apply the next day. So a few other things that I've just learned in the last few days. So I think we all know that Italy is a disaster area right now. They have a very high death rate. It's gotten so bad that they've run out of health resources and are actually rationing care as if this was a frontline war triage center. So that's the thing we have to prevent. It's at WHO estimates that 40 to 70% of people in the world will get this by year's end. So most of us who are here are going to get it. The thing that we have to be concerned about is overwhelming medical resources. So you may have seen something lately called Flattening the Curve. It's been online, it's been on the news. It's got a very nice graph, but a lot of people don't understand what it means. So I'm just going to tell you very, very briefly. What it means is most of us are going to get coronavirus, but we have to spread it out so that not many people get it at one time. Because if everyone gets it at the same time, there are not going to be enough health professionals, enough ICU beds, enough ventilators to take care of all of us. That's what flattening the curve means, slowing it down, not stopping us from getting it, but slowing down the rate at which we get it. And a prominent infectious disease doctor yesterday posted a very nice post online about how the next 2 weeks in the US are the most critical time. So all the things we talked about, especially social distancing, that's far and away the most important thing. The next 2 weeks are basically the make or break point, because they say we're only about 11 days behind Italy in terms of following the same pattern. So the next 2 weeks, it's really critical that people stay home as much as possible. The other thing I'm seeing online is a lot of mostly young people. I'm not picking young people, but it's mostly young people who think that they're invincible, going out and partying and going to restaurants and going to bars because they say they're young and healthy, they don't have to worry about it. First of all, young people get it at the same exact rate as older people. They just don't basically die as often, put it bluntly. They're not as sick. Many of them. There have been plenty of deaths of younger people too. But everybody's only 1 or 2 degrees of separation from everybody else. If you go to a restaurant and the restaurant's crowded with other people like you, maybe you won't die. But then when you The next day, a couple days later, go to the grocery store, and the person who is sick, who is immunocompromised, who is older, who is trying to stay home completely but has to get groceries every once in a while, is in that store, you can give it to that person and that person may die. So don't be a jerk. Basically, just don't be a jerk. There's someone really famous online who's getting skewered right now. I won't mention her name, but for posting typical Instagram pictures of being out in crowded areas and, you know, the I'm young, I'm invincible sort of attitude that all of us had when we were younger, granted, but it's just really, really important now not to do that.
Absolutely.
And that's why social distancing is so important. I was just telling Laura earlier, thank God we live in a time now when pretty much everything is available online other than physically getting food, things like that. So we can stay socially connected like this now. Okay, so let's talk about coronavirus and COVID. I was mentioning to Laura earlier, I was just really ticked off earlier today when I saw an email from a prominent Midwestern bird store. I'm not going to mention names, but probably a lot of you got this email, so you can guess who the email came from. And one of the topics listed was, can I give my pet bird coronavirus? And the answer, when you click on the link, was yes, which is wrong. And second thing was yes, because it's a zoonotic disease. That's also wrong. Those of you who have attended my earlier talk with Lara might remember that zoonotic disease means going from the animal to the person, not the other direction. So both those things were wrong, and now a lot of people are probably in a panic having seen that email. So even though I'm not going to name names, I feel like I absolutely have to address that, and that's some of what we're going to talk about today. So one of the big things I have to bring up is that people are using the term coronavirus and COVID-19 interchangeably. You can't. They are not the same thing. COVID-19 is a coronavirus, but there are hundreds of coronaviruses. There are coronaviruses that affect humans, and we know of 7. There are 4 that cause things like common cold, and you never hear about them because they're just minor. There are 3 of them that have caused serious human disease. First one being, I think it was 2003, was SARS in China, or actually 2002 in China. That was the big one, had a high death rate, caused a lot of problems, and then sort of disappeared from the scene. Second one was MERS, M-E-R-S, and that was in the Middle East. So it's Middle East, M-E is Middle East. That was in 2012. Also caused some deaths and some issues, and it wasn't as bad as SARS. And then that sort of disappeared off the scene. And the third one is what we're in right now. It has a couple names, but I think most people know it as COVID-19. And so those are the 7 that are in humans. Now, there are coronaviruses that affect other animals, primarily mammals. There's one in birds. It's called infectious bronchitis, something infectious bronchitis. I forget what the third word is. But anyhow, that has affected some chickens in the past. There have been some outbreaks in the past. There have been some outbreaks with cows and farms. Most of what we know about this comes from farms. So there were outbreaks with chickens, with cows, and with pigs. We know there are some other mammals that get it, but in the 3 cases of the human ones that have been the serious ones, these were viruses that were in animals, and we're still not 100% sure what animal started this in China, the current outbreak. But they're not transmitting directly to humans. What they're doing is mutating. They mutate into a form that the human can get. So if you remember the H5N1 or bird flu back in the 1990s, it was actually, no, I'm sorry, not 90s. I think it was about 10 years ago, 10, 15 years ago.
Yeah, I was going to say, because I remember I was already here at the center, and we've been here at the center a little over 8 years.
Yeah, I think it was 10 years. I think it was 2009, if memory serves me right. The fear wasn't so much the humans getting it, and humans got it. Not a lot of humans got it. It was very deadly, but not a lot of humans got it. The fear was that it would mutate into a form that humans could share with each other. The fear was a pandemic. We are in a pandemic now. We have gotten a virus from an animal. It mutated so that humans can pass it on to other humans. This is what our fear was with H5N1, because H5N1 had a death rate of at least 50%. So if something like that spreads between humans, you're talking about half the world's population is going to die. So the death rate isn't as high with this, but it's certainly not low. It's 10 to 20 times higher than flu. So if you hear people saying, oh, this is nothing but a flu, they're wrong. It's not necessarily, well, I shouldn't say, it actually is at least as contagious as flu, but it has a higher death rate. So that's why we're concerned about this. Also, regular garden variety influenza, we have treatments for. We don't have any treatments currently for this. So those two factors are what's making this such a serious illness. But getting back to the coronavirus versus COVID-19, people aren't understanding that they're not the same thing. So you'll hear, well, can birds get coronavirus? Can my pet dog get a coronavirus? Can my cat get coronavirus? Can they give it to me? These are the questions that we as animal companions want to know. So the short answer with birds is, can they get coronavirus? Well, yeah, sure. There was a paper last year about an eclectus that got coronavirus, but it wasn't COVID-19. It was a bird coronavirus. In fact, it was the one that chickens get. That's the only coronavirus we know about in birds. There are estimated to be hundreds of coronaviruses. In fact, it's the most common virus family in the world. So coronaviruses are all over the place, but each coronavirus is different. So when I gave my zoonosis talk, we talked about what diseases are transmissible between humans and birds and what diseases aren't and why. There's some diseases like salmonella, for example, that everybody in the world can get. All mammals can get it, all birds can get it, all reptiles can get it. I presume amphibians can get it. I didn't really check into amphibians, but I know obviously reptiles get, we all hear about turtles having salmonella. So salmonella is a classic example of a disease that likes everybody. So everybody can give it to everyone else, humans, animals. At the far end are diseases that aren't transmissible. You, for example, can get leukemia, but you cannot get feline leukemia. That's a different virus. The reason why not everything is transmissible is because these organisms have evolved over millions or billions of years for very specific hosts. They do their best when they can have a really good fit with the host, and then just attack it and get whatever they need to out there. Usually what these viruses or other organisms get out of the host animal is the ability to reproduce really well inside that animal. So that's what they get out of it. But in order to do that, a lot of times they're really specific. So for example, our average temperature, 98.6 plus or minus. Dogs have much higher temperatures, birds have much higher temperatures, cats have much higher temperatures. A lot of these organisms evolved to work at only very narrow temperature ranges. Or there may be other host factors, certain types of cells, certain whatever's specific about that animal. So they evolve to work well in that particular animal. But because of that, your animals will get certain diseases that you don't get, and vice versa. One I do have to bring up, and I brought up in my last talk, that's really important because the flu is still very, very, regular garden variety flu is very prevalent still right now. Influenza A, and there are three types, there's A, B, and C. B is very common this year, particularly in children. That's the one that children are getting. Influenza A is actually transmissible between birds and humans. So if you do have the flu, influenza A, you can give it to your birds. So you really have to avoid direct contact with your birds if you have that.
What about other animals? Sorry, just because
No, that's a good question. I would say probably yes.
Okay.
Because birds are obviously much more distant than us than dogs and cats. So if you can give it to a bird, I would assume you probably could give it to a dog or cat. I didn't specifically look it up, but I would say there's probably a good chance you could. Especially you need to avoid things like kissing, direct face contact. You need to wash up between them, things like that. So influenza B is not transmissible. All the horrible bird flus you hear about, H5N1, H1N1, all those things, those are all influenza A's. Those are usually the most common flus we get. This year is more of an exception in that there's a lot of influenza B around.
Is there
That's not common.
is there a way to tell what type of influenza you have? Can you be tested?
Yes,
Okay.
yes,
Ask your
yes.
doctor.
When you're tested, yes, when they actually do a test for influenza, it does tell what kind of flu it is. But like everything else, if you're sick and you're drippy and all that, try not to handle your animals anyhow. We have lots of germs, and we carry a lot of germs like gram-negative bacteria in us that our pet parrots do not have normally, and they should never have that in them. So if you're dripping because you have the flu, well, maybe they can't get that flu from you, but your drips are going to be having all your other bugs in them. So that's going to get to your animals. So with any sort of illness, you want to avoid close contact with your animals. Obviously, if you live alone, that's difficult. But you can at least avoid things like snuggling with your animal and just try, as much as the animals don't like it, just try to stick to very basic care with really good hand hygiene and face hygiene. So getting back to coronavirus and COVID, yes, you can call COVID-19 a coronavirus because it is a coronavirus, but COVID-19 is the thing we're worried about now. And to our best knowledge, you cannot give COVID-19 to your birds or to any of your other animals, and you cannot get it from them. So if you look at the Petco link, I encourage you to read that. They have a couple of infectious disease bets on there. Again, talking best evidence, they feel you can't do it. The American Medical Veterinary Association, their post is a little out of date because they're talking about the dogs and how they're currently undergoing testing. I'm sure most of you heard about the dogs that are in quarantine by WHO that were let out of quarantine a few days, leading to probably the funniest COVID meme I've seen so far, which is who let the dogs out. Technically correct and also funny. So there was a dog that tested weekly positive in China. That's how the whole dog thing came up. But they've done more extensive testing because there are different levels of testing you can do. There's the testing you do, which is trying to pick up the most cases, and then there's testing that can actually confirm if a particular animal has something, including a human. And apparently the specific testing they did showed that the dogs didn't actually have it. Is it possible that the dogs could have some low level of it? It hasn't been 100% ruled out, but it doesn't seem to be a prominent thing. And right now we have over 150,000 identified cases of COVID-19 in the world. Obviously, they're probably, at least in the United States, because we've done an absolutely terrible job of testing and having testing available, our numbers are probably at least twice or three times or whatever times larger than is being reported in the news. All this time has gone by. COVID's been around since December, first really noticed in January. We haven't heard of a single case of any animal of any kind giving COVID to humans. We certainly have, and specifically with birds, we haven't heard of any cases of a human giving COVID-19 to a bird. My feeling is if it was going to happen, we would have heard about it by now. Can we be absolutely 100% sure? No, but I think we can be 99.9% sure at this point that you can't give COVID-19 to your birds and they can't get it from you. Now, I do have to bring up something, this word for it called fomite, fancy term. It means getting disease, or basically diseases living on surfaces. Now, you've all heard that COVID-19 lives really well on hard surfaces, potentially up to a week. And I heard that plastic is probably the worst of these things. But if you have a granite counter or linoleum or any of these things, COVID-19 is really good at living outside the body. That's another thing that sets it apart from garden variety flu. Flu doesn't live long outside the body, maybe a day at most. COVID-19 sticks around a while. It sticks around less long on softer surfaces, surfaces like, for example, feathers or fur or fabric. It's still going to be on there. But so if you sit down on a chair, let's say you go to the movie theaters and you disinfect the arms, but the seat itself, it's remotely possible it could get in your clothing and get you, but not high likelihood. That's not going to be a big vector of transmission. It's going to be more hard surfaces. So the issue, going back to that dog in China, was they found some COVID-19 on his fur. So if you have a dog, and if you have a dog, you're undoubtedly petting the dog many, many, many times during the day. Same thing for a cat. So if you are actively shedding COVID-19, it could get onto the fur. Not going to make the dog or cat sick, but could potentially be transferred to somebody else if they were right there in the home. It's not going to last long on the fur. Within a day, it's going to be gone off the fur. Could potentially happen on feathers. Again, haven't seen anybody test that, but if you are stroking your bird's back, for example, or its head or something, you could, and you are shedding heavily, you could potentially transfer. So another reason why, particularly if you're sick, you should not be snuggling with your birds. It could get on there. Is it going to make them sick? No. Could it transfer to someone else? Maybe, if someone were right there right after it was done. So getting back to, well, let's talk about COVID-19 just in general. Why are we talking about soap and water versus sanitizers and all that? Well, COVID-19 is a ball. Basically, it's a viral ball. And the outer layer is lipid, which is basically grease or soapy stuff. That's what outside is. Well, when something is made of soap, you can get rid of it with soap. If something repels water, then water doesn't work with that. So you kind of have to know what the organism is. So this is basically a big soapy ball. In order to get rid of it, you need soap. If soap contacts COVID-19, it just breaks it open. That's it. It just destroys it. Sanitizer will work, but it needs to contact longer, and you need more of it. It's not as good as soap. That's why you hear everybody saying use soap. Well, soap is great if, let's say, you're in public and you go to the bathroom and you have a single stall where you can immediately wash your hands before you pull up your clothing or touch your face and all that. Less useful in a public bathroom with stalls, because you come out of the stall, you got to put up your clothing, you get to the sink, by then you've touched things already. But soap is going to break it up. But what if you're just out in public? What if you go to a restaurant? What if you go to the theater, or you go to the bank, or you go to the grocery store? You're not going to walk around with a bucket of soapy water around your neck and washing everything. So that's why sanitizer is good. That's why sanitizer wipes, if you can get them, are good. I went to the grocery store yesterday. I took out the wipe and I wiped down the shopping cart first. And I kept actually the sanitizer wipe on the handle. And my hands touched that through there. Now, obviously, I'm picking food off the shelf. People may have touched that already. You can't be 100% secure. But that's why wipes are going to be even better than, for example, let's say you go shopping and then when you're done, you Chiral your hands. Well, you've already touched yourself many, many times by the time you're done. So it's best if you can do some sort of a wipe first. If you can't do a wipe, even a tissue. I was telling people, like, if you have to hold on to a railing, if you have your mobility impaired, use a tissue to hold on to the railings and then just immediately dispose of it. Bring a Ziploc bag and put it in there. It's not going to get through the tissue in the short amount of time in the railing. And what I don't want to see happen, being mobility impaired myself, is you don't want people to avoid holding railings and then fall and get hurt, because that would be a terrible thing. So you still need to use railings, but you need to understand how things get transmitted. The other thing you keep hearing is don't touch your face. Well, that's just, it sounds great in theory. It's not going to work. Studies show that you touch your face anywhere from 30 to 100 times per hour. And there's nothing you can do about it. You can sit there and go, I'm not going to touch my face, but you're going to. You're not aware of it. We all do it. And that's not going to be, to me, that's just not useful information, because that's something that's just not going to happen. So yeah, it sounds great in theory, but in practice, it's just not going to happen. And it's like telling yourself, don't scratch an itch. Well, the more you tell yourself not to do it, the more that's all you can think about is scratching the itch.
I know, my face itches really bad right now.
It's just, so to me, that's not useful advice. Social distancing and soap-based things or disinfectants. Of course, right now you can't buy it to save your life. And it's nice and good to say, okay, go ahead and get some disinfectant, but you can't buy it. You can't buy that. You can't buy toilet paper, paper towels, bread. I was at the market yesterday. Bread is disappearing off the shelf. We're going into full survivalist mode. And of course, one of the problems with that is people who are poor and can't afford to stock up can't buy these things ahead of time. So, but anyhow, I'm kind of getting off the topic there. So when you see coronavirus, can birds get coronavirus? The answer is technically yes, but not COVID-19. So if you see that, please, please, please keep that in mind, because people don't understand the difference between those. And that's why I'm trying to decide whether or not to send an email back to this particular person to ask him to correct it. But I've done that in the past, and he is not even providing him with hard evidence, and he's not been terribly open to issuing corrections or even acknowledging that the information he has might not be accurate. So I may not bother, but I'm hoping the people that are on this tape will spread that out so we can avoid widespread panic over this.
That's just unnecessary panic induced on the top of something that we're all trying to figure out how to work through this.
Exactly, exactly. And if you don't know correct information, don't say anything. You know, that's sort of it. Now, on the topic of food, so let me mention about, animal food. I don't think there's been a run on animal food the way there has been on human food, at least sort of mail order places. I don't know for a fact, I just haven't heard anything. And I've been checking like the prominent bird food sites to see if they're posting anything. There could be in the supermarkets, I don't know. But one thing you have to keep in mind, you may say, okay, well, there's not a run on bird food. I have enough bird food in the house for a few weeks or a month or whatever. A couple of things to keep in mind. One is, and this is going to be a big topic we're going to be discussing here today, what to do if you're incapacitated. How can people take care of your animals? So you need to have extra food because maybe you won't be around. Maybe you're in the hospital or worse, maybe you won't be around to order more food. But another thing is our supply chains are being heavily damaged right now. You got to remember, people are people everywhere. If you work in office, your office has probably by now told you to work at home. But all the people that actually handle anything still have to go into work. So let's say you go online and order from one of the big bird food places. You may be online, but remember, at their end, someone has to physically go to the warehouse, pick the bird food off the shelf, or any animal food. They have to get the animal food off the shelf. They have to package it up, and they have to send it to you. If half their workers are out because they're sick or they're in isolation or they're quarantined, they're not going to have the staff to do it or do it in a timely manner. Then after they send it to you, it's going to be going by post office or UPS or FedEx, or if you're overseas, DHL, or whatever service you have in your country. Well, those people are also going to be sick or in isolation or in quarantine. So there are going to be delays in getting this stuff for you. So that usual 2-day you're used to from Amazon, or potentially, 3 or 4 days from some other company, might turn into a week or two. It might be heavily delayed, not because they're out of this stuff, but because it takes human power to actually get the stuff to you. Even the same thing that people who manufacture the food that was sent to the warehouse for the company, they may be short on people in the factory to make the food in the first place. So you have to give things plenty of time, and you should err on the side of having more food if you can afford to get more food in stockpile, and it won't get bad, because if you wait till last minute to get more food, you may not be able to get it in time. Same thing for medications. You get animal medications, whether you get it from a vet or an online store, there may be delays in getting it to you. Remember that healthcare workers are disproportionately affected. So the vets aren't going to close because of this. They know they're healthcare professionals, and even though their animals aren't infected with it, they still have to see the animals. But they may be delayed in getting you medication. So this is all important for you to keep these things in mind and be prepared for shortages and plan ahead. Okay, so let's see. Ooh, it's getting late already. So let's get to
That's
the main
okay.
topic.
You're giving me a lot to think about that I wasn't thinking about.
I get, being a physician and an animal companion and all that, I've been thinking about these things nonstop. And I've been a little bit surprised when I've been posting on social media that a lot of people haven't thought of these things. So I guess the way my mind works, I'm just constantly thinking about these things. But I found a lot of people aren't. So I was really, really happy when Lara asked me to come and talk about this because I want to get this information out there. I want people to be thinking. It doesn't mean I have all the answers, but if you don't start thinking about it, you'll never have the answers to any of these things. So now the big issue, and this is the scariest issue. Okay, so without COVID-19, obviously you all know that you should have someone that can take care of your animals. If you're sick or you're incapacitated, you're in an accident, you have a heart attack, whatever the issue is. Not everybody has that. And that's talking about just routine. Not everybody has people living in their homes, has a best friend living next door, has club members that live near me. Being a member of a bird club is a huge help because I can tell you with my bird club, we have responded to emergencies many times over the years where people who were incapacitated or one guy had like 40 parrots and his house burned down. The animals, or a lot of them, got out, but he suddenly had no place to go, no place to live, no one to help him take care of the animals. So being in a bird club or some sort of organization where you can help out other people, especially in times of need, is really helpful. But there are a lot of people who don't have someone who can help them. That's under the best of circumstances. Or maybe they have a relative or somebody who can come in, maybe somebody who doesn't like birds or dogs or cats, but is willing to help you out. You're in the hospital, you've had a heart attack, you got to be there for a week. So that's always been important in general. And there are a lot of people who say, I don't have anyone. I said, well, you don't have anyone now under the best of times. You think finding someone's going to get easier when you're sitting there waiting for the ambulance to come? No. So we've had people join our pet club specifically for the purpose of having backup. And that's fine. That's fine. But now it's infinitely more difficult. So why is it more difficult now? Even if you have someone in your house. And by the way, just having, let's say you have a spouse or a partner, doesn't mean you're foolproof. About, I don't know, 15 years ago or so, two members of our club, a husband and wife, were out driving and they swerved on the highway to avoid missing a deer. Car overturned, both seriously injured, both were hospitalized. So they had each other, but they were in the car and both injured at the same time. So our club went over there. They had about 30 large cockatoos that were all rescues. And the club sort of joined as a group and went over to take care of the animals. And they actually had a son, but he didn't live with them, and he had absolutely no idea to take care of animals. So, which brings up the other point, please, 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 and this is something you can do today, write up a set of instructions, where all the food is, where carriers are, where everything is, because even if you have someone, they aren't going to necessarily know where everything is in your house or what to do.
Or what they need.
Or what they need, all these things. So that's something you should just always have on hand. And you should always have several levels of backup if you can, because what if you are in an accident with the other person in your household? It certainly helps. Okay, so now, COVID-19.
Can I ask you a quick question real quick?
Absolutely.
That came up?
Yeah, I haven't been looking over here.
This is from Daniela. What is the idea? Because I know there's a lot of people on here besides just bird people. What is the ideal supply of bird food on hand as of today?
Okay. I would say at least a month's worth. More if you can do it. If you have freezer space, you can freeze some bird food so it doesn't get mothy. Right now, it's not hot out here in the US. You may be dialing in from other places where it's hot, and it is going to get hot. So obviously, if it's hot, then you have more problems with things like moths or spoilage, mold, things like that. So I would not have less than a month. Even if let's say you end up in the hospital and let's say you were on a ventilator and you come off, they're still not going to let you go home right away because you're still very infectious. Oh, that's another good question, and not a great answer to this. How long are you infectious after you have it? Potentially up to a month. Anywhere from 2 weeks to a month after you contract the disease, you are still shedding the virus.
And then,
but another thing to keep in mind, and I just saw someone posting this today, people are trying to say, well, okay, I might get quarantined for 2 weeks at home, but you may be quarantined multiple times. Someone was posting today, she just finished her last day of quarantine, was looking forward to getting together with her parents, and then she got notification she was exposed to another person. So you could end up quarantined for months potentially if you just keep having exposure to people. So I would say at least a month. If you can do 6 weeks to 2 months, even better. And this is across all animals.
And then, can I
600 pounds of parrot. Wow, Shelley, 600 pounds of parrot food, 400 pounds of dog food, and 100 pounds frozen. Kudos to you.
I was telling Shelley, I wouldn't be careful what you post publicly, because I've been in situations before where you may not think people will do certain things until they get extremely desperate.
Exactly.
So
right. And this chat won't be public, just the video, right, Lara?
I believe, yeah. You know what?
Yeah, chats don't usually go with the video.
Okay. I can choose to have the chat public, but you're right. There's an audio, there's a chat, and then there's a video.
Right. Though those links that you posted, hopefully those will actually get posted on there.
I'll manually post them.
Separately,
Can
right.
I ask you a quick question, because it's pertaining to what you're talking about now? And I know, tell me if I shouldn't be asking this or you don't feel comfortable answering it. I could have coronavirus for so much period of time before I even show symptoms.
Right. The incubation period and
COVID-19.
Yeah. Right. COVID-19. Right. The incubation period is anywhere from 1 day to 14 days. It's kind of crazy. Like if you get a common cold or the flu, it's 24 to 48. We have this huge range here. And I think that's just because we don't have great information on it with everything going on, because it'd be highly unusual to have a virus with such a wide range. But the average is 5 days, though, 5 days after exposure to come down with symptoms. It can be as short as 1-2 days, though, and can be as long as 2 weeks. That's why this whole 4-week self-isolation. By the way, self-isolation and quarantine aren't the same thing. Self-isolation and sort of and quarantine, right. So quarantine is if you actually have the illness and aren't sick enough to go to the hospital. So you quarantine at home for 14 days if your public health department allows you to do that. Self-isolation is if you've been exposed, you have a known exposure or a possible exposure, but don't have the disease. Also 14 days, because of this, it can take up to 14 days to manifest symptoms. So are you contagious before you have symptoms? Yes. Just like you are with flu, just like you are with measles. You are contagious. You're not as contagious as when you're dripping. Once you're dripping, then you're actively shedding virus, but you probably are shedding some virus before you're symptomatic. Again, another reason why, I'm healthy, I can go out and contaminate other people, but you might be giving it to them before you have the symptoms. And then then they talk about how many people have recovered from coronavirus. Well, what does recovery even mean? Recovery being basically you're not showing active signs of infection or disease. We think you can shed up to 30 days probably after you first contract it. So you can be contagious for quite a while, even if you're not actively having trouble breathing or dripping stuff. So again, these are things that make this virus so horrendous and so contagious, and why it's spreading like wildfire through the world. Okay, that answer your question?
Yes, it does.
Okay, so now the sort of the most important thing. So we talk about having backup for people that can take care of your animals and all that. But we have a huge added twist now. So let's say you get sick, you end up in the hospital with COVID-19, not with a heart attack or something unrelated. Oh, and actually, before I even say that, right now they're testing people to see if they have flu or COVID-19. Keep in mind, you could actually have both at the same time. You could have a head cold and COVID-19. They're not necessarily mutually exclusive. You could have a stomach virus and COVID-19. People can catch more than one thing at a time. That's why it's so critically important that you're up on vaccinations, that you've had a flu vaccination. You can actually still get one now, because we still have, even though it's mid-March, we still have very active influenza going on now. If you have one illness going on, it makes you more likely to not only catch another illness, but to be more sick from it. So if you have flu and you can get COVID-19, you may have a worse course with the COVID-19. That's why people with chronic diseases are obviously doing more poorly. That's why older people are doing more poorly, because you get more immunocompromised as you get older. 60% of people in the US have some form of chronic disease. So when you hear media saying things like, oh, you're fine as long as you're young and healthy, not only is that really insulting to all of us who aren't young and or healthy, it's just a really stupid statement, because the majority of people have some sort of disease that puts them at higher risk. So just because you might have classic flu symptoms doesn't guarantee you don't have COVID-19. And we don't know for sure you can't get it again. You can get flu twice. You can get flu twice in one season. You can obviously get colds multiple times. Some viruses, once you get them, like chickenpox, you don't get again, though then you get shingles. Other viruses you can get. So you can't say, oh, it's a virus, I will get immunity. We don't know for a fact you can't get it. There have been some reports out of China of people getting it again. Probably not common, because in China, it has slowed down considerably and there aren't many new cases again. I think if you could really very easily get it more than once, you'd see a second uptick. And that might be coming. We do know, for example, there appear to be 2 strains of COVID-19. So you could get one and then get the other. So again, I'd love to tell you some good news. I don't have a lot right now. Getting back to the animals. So let's say you get COVID-19, you're sick enough to go to the hospital to leave your animals. What happens to your animals? Okay, so you could try to leave a lot of food for them. If you have a dog or cat, probably a good idea to get one of those self-feeders that only gives a certain amount, particularly dogs, because you know dogs will a lot of times just gobble down all the food. They're not going to parse it out. If you have birds, maybe, you might be able to just take a whole bowl of food and just, like a big Tupperware container, put at the bottom of the cage, enough to last for a couple of weeks. If you have pellets, things like that, obviously you're not going to be able to do fresh food. If you have reptiles that have live food, then you're going to have a real problem. Or if you have fish, it's not like you can go dump a whole container of fish food in there. But start thinking about ways that you might be able to leave a lot of extra food. If you have birds or other animals on medication, then you have a big problem. One of my cockatiels is on medications twice a day. One of his medications, if you were to stop it abruptly, could give him seizures, not because he has seizures, but from stopping a medication abruptly. Now, you have plans in place. You have friends, you have neighbors, you have family members who, under normal circumstances, would come in to take care of your animals. But now you're in the hospital with COVID-19. Your house is infected. Are these same people going to be willing to come into your house when they might get COVID-19 from being in your house and servicing your animals? Now, if this is a close friend or family member, maybe. other people that you have lined up are probably going to say, I'm sorry, but it's not worth risking my life for your animals. I'm really, really sorry, but I can't put my own life at risk. Probably, from my postings on social media recently, I'm getting the impression a lot of people have not thought about, which is why I want to talk about this today. So how can people come in your house? How can people safely come in your house? Can people service the animals in your house? Can they safely remove them from your house and take to their house without risking them or their families? You might have someone say, well, I'm willing to take the risk, but I have children at home and I'm not going to risk their lives to save your bird, your dog, your cat. What are you going to do? So I've been thinking a lot about this because obviously this affects me as well and everybody I know. There's some things you can do to help. Now, you may have someone who just says, no matter what, I'm not doing it. And then the worst case scenario may happen that your animals may die in your absence, which is obviously something none of us want to think about. But there are things you can do to help. Now, first of all, obviously the normal things, have the instructions, have food, have all that available. I would keep a bunch of the food in an area that's nowhere near the animals and it's just sort of locked away. Like I keep most of my food is in metal cans in the garage. It's just easy for me to store it there. The garage is usually cool year round. So if someone were to go get that food, it's not going to be contaminated because I take out bags of food that last maybe a month. So I will not have likely gone into that can. So the can of food is probably safe. You could have, let's say, I'm going to kind of focus on birds because that's where my thinking is, but you could have, if you're in a house or an apartment, what your circumstances in, like I have multiple extra cages that are downstairs that I've just accumulated over the years. People give you cages. If you can have some cages, especially if they can be set up before you're infected, they don't have to be fully set up, but throw a few perches in them, maybe a couple toys, have them set up somewhere else in the house, a place that you don't go to, in a closet or something, and just have them there so that a bird could be taken from their potentially contaminated cage and put in one of those cages, and then that person could take the cage and that cage itself wouldn't be contaminated. Keep some supplies, toys, perches, other things, someplace else away from where you normally contact so that that area would be clean. Now, I know that's going to be more difficult. Like if you have fish, I don't know kind of what you do with that. Or a reptile enclosure, you might not be able to have that. But for example, I have a turtle. She has a very nice pen, but I also have just a large plastic box with her substrate and a water dish in it that I keep in the garage. So when I travel, I actually put her in that and take that because her pen itself is not movable. But that's in an area right now where it wouldn't get contaminated by me. I'd have no contact with it. So someone could just take my turtle, put her in there, and they'd be able to go. Dogs and cats, again, keep the food somewhere else. Put whatever they need. Carriers. Maybe, we always, like I keep my bird carriers near my birds in case there were some tornado or catastrophe or something, and I had to just grab them and go. Might want to think about keeping carriers someplace a little more distant. You can still get to quickly, but like in the basement or in a closet, because then they're not going to get your droplets on them. They're going to be safe. So someone, if they can get the animal, can put them in the carrier. So, dog and cat, if the animal needs to be crated, particularly cats, keep a cat carrier, but keep it away from where you normally do things. For dogs, keep leashes, leads, whatever you use, again, someplace else in your house or if you're in an apartment, have a clean box in the closet that has some of these things. So the person could grab a leash they know to be clean out of there and clip it on to your dog's collar.
Something I just thought of, and I just got a text saying all bars and restaurants are being shut tonight at 9:00.
Where you are?
Yeah. What if, like, somebody you knew was going to take care of your animals, you could take these crates over, and if you have extra crates, put them in their basement now.
Yes, in fact, I've done that when I've gone away before. I had a friend that used to watch my birds and turtle, and I kept extra cages there. The only problem with that is, now what if that person is infected too?
Yeah.
So, and there are only so many people you could do that with. You know, at this point, I would say it's best to have 2 backups, at least if you can, because a lot of people are going to be infected. Doesn't mean they're going to be sick enough to go in the hospital, but a lot of people are going to be infected. So, and you could be infected, and let's say day 5, you start having your fever, your cough. Keep in mind, by the way, that sniffles, runny nose are not part of COVID. That would mean if you have a head cold, you have a head cold. You don't have COVID. Can't guarantee you don't also have COVID as an unrelated thing, but head cold symptoms are not COVID. But yes, if you can do it, if you have, let's say, a family where there are multiple family members, absolutely see if you can put some stuff there ahead of time, on the hopes that not everybody in that particular family group would be sick enough to go in the hospital. So again, if you're sick in your home, you're fine. It's just if you're going to end up in the hospital, or again, worst case scenario, die. Obviously, any of us can get sick and die of any number of things at any time. It's the infectious nature of this that makes it difficult. So, okay, so that's keeping extra supplies. Now, what about getting that person into your home? You don't want that person to get sick. So some things you want to do. And again, I know it's really difficult now. I ordered a lot of stuff online. So I have a case of sanitizer wipes. I have a case of hospital grade bleach wipes. And I have a case of these little Chiral packets. You know, one place to go, because everyone's going to traditional stores, you can go to a medical supply house online, and you don't need a medical license or anything to order these kinds of things. Look up medical supply houses. A lot of them have these things available, and it's not a place that traditional shoppers think to go. Obviously, you know, you have to be careful about stockpiling stuff, because we don't want to take things away from the healthcare providers. But you can certainly go get yourself a case of bleach wipes and things like that online. Probably, you know, we're not a huge amount of people, without impacting hospitals' ability to get stuff, because these companies do have a lot of these things out there. So that's where I got my stuff. Be prepared to spend money. You know, if you don't have the money, this just makes everything so much worse. But if you have the money, get those things now. Let whoever would take care of your animals know where these things are. Keep them near entry points to the house. Someone comes in, they can grab a bunch of wipes, and they can use that to disinfect things. Again, soap and water is the most effective things. Obviously, keep in mind, anything that's bleach-based cannot be around your birds. You will kill the birds. So you have your bird cages, for example. You're sick, you go to the hospital. Person comes in. Mask really isn't going to help. We know masks aren't helpful. It's not going to be a big help to work. If they have a respiratory mask and they want to wear it, you know, that's fine. It's not going to guarantee they don't get the disease. You're not there because you're in the hospital, so you're not going to be there to breathe on them. So it's just a question of anything that might be left on surfaces. Again, depending on how much time has passed between the time you've left the hospital, left your house, your home, and the time the person comes in, probably most of the viruses are already going to be gone. But let's say it's only been 6 hours or 8 hours or something. If it's a day or two, they're probably completely safe. But if it's within a day, anything that's there is going to be on a surface. So they're going to want to wear gloves. I try to leave them some gloves. You can buy nitrile gloves online. They're still readily available from what I can see on Amazon. You can get a box of gloves for $10 or something. So I would recommend getting a box of gloves, getting some wipes if you can. The person may have some of their own, but wipes are good because they can come in and they can wipe down surfaces. They can't use the wipes on the bird cage, but what they can do on the bird cage is even simpler. They can just go to the sink and get some soapy water, put it on a washcloth or a paper towel, and they can, with the bird in the cage, they can just use a little soapy water and wipe down the surface. I have to check. Pet Focus, I know it's bactericidal. I should actually look at my bottle. I'm pretty sure it may be virucidal. I gotta go look that up. I saw someone post that it was, but I always check these things for myself. Not Poop Off. Poop Off has no activity against bacteria or viruses, but Pet Focus, which is another enzymatic cleaner, that's what I use for cleaning, completely safe around birds and reptiles and everyone, including us. So wipe down they can just use soap and water. And with the birds in the cage, just wipe down the surfaces of the cage, wipe down the food dishes with the soap and water, and that will just destroy any viruses there. And then once they do that, they can open the cage, wiping as they go, remove the bird, or take the whole cage with them. But if they want to, they can remove the birds, put them in another carrier. This, of course, depends on the bird and depends on the person's comfort with the bird. If you have a bird that's a little terror and is going to bite people, people may not be as willing to do that. To that end, if you have that kind of a bird or a reptile or another bitey animal, maybe you want to go get a pair of, right now, or order online, get a pair of heavy work gloves, just regular sort of work gloves that the person can put on so they can safely get your bird. Because if they can't get your bird out of there or be able to take care of your bird, there's going to be a problem. Your bird's not going to be emotionally scarred because someone grabs them with a glove. They're going to get over that. But the important thing is to keep whoever's going to take care of your animal safe. That's number one priority for them. How are you going to feel if you give COVID-19 to the person taking care of your animals? So wipe down the surfaces, wipe down everything you can. Have them wipe down everything you can. Let them know that you've made these plans, that you're thinking of their safety, and that you have these supplies available. Tell them where the supplies are. Or if you're on the way out to the hospital and you're in good enough shape to be thinking these things, take everything out where it is and leave it right where the door is where they come in. So when they open the door, it's right there and they can get it right away. That's just really important for their safety, and then of course that will end up being for your birds. Discuss it with these people ahead of time. Don't wait till it happens. Tell them, you're my emergency backup. Are you still willing to do it? Make sure they are still willing to do it. Tell them, these are the steps I've taken. This is where the food is. This is where the care is. They're in a place that won't be contaminated if I get sick. These are the supplies I've given you that will take care of things. So that will go a long way to helping fears. I already have my backups set. One of the persons happens to have hazmat suits because she had an outbreak of a bird disease in her house, and she was going to take care of someone else's birds who also had the outbreak. So she had the suit on to protect her and to protect the person's birds. So I know she can actually come with a hazmat suit. Those are not readily available to people. And frankly, is going to be overkill with this. Again, once you're out of your house, all you're worried about is any residue. The residue that's on something, so if there's residue on a surface, it's not going to be airborne. It's not like dust that you're going to stir up walking into your house. It's just going to be on that surface. So they don't need respiratory protection. All they need to do is wipe the surfaces. Again, soap and water is going to be safe for the birds. Other cleansers may not be safe. So you always have to keep that in mind. And make sure the person knows that. Make sure they don't show up with a bottle of Lysol to spray.
Yes.
If they do that, Lysol will kill birds. So make sure they know, because the person taking care of your birds may know how to feed them, but they may not have the same knowledge about this that you do. So it's really, really important. If your animal needs medication, whether it be a bird or a dog or cat or anything, make sure you have the medication available and that the person knows how to give it to the animal and practices. So like my house cleaner, for example, who would be the first person I call because she's nearby and she's really, really comfortable with my birds and everything. Periodically, like once a month, I have her give my bird on medication so she can get used to it and not have no idea what to do. We just did this again the other day. So these are all things that you would normally have to do, but now with the threat of the person getting infected on top of it, it's just going to make things so much worse. I'd love to hear other ideas. These are just things that I've come up with off the top of my head because, as I said, I think about this kind of obsessively now. I'd love to know other ideas people have. And so I want to open this up for everyone to throw their ideas out, because this is a group effort. This isn't me lecturing you on these are the things you have to do. We all have to come up with common sense ways to do this. And the fact that you're all here on this cast means that you all love your animals and you really want suggestions, and nobody wants to see anybody's animals die. And we certainly don't want a repeat of what happened in China, where thousands of animals were left behind in Wuhan when people were not allowed back in. And obviously, the vast majority of those animals died. And on top of all the horrible devastation, having your animals die is something that none of us want to have happen. So I haven't even been looking at the chat. Do we have some comments on there?
Yeah, Bobby Boykin posted that, what was it? Pet Focus is virucidal.
Okay, great. You looked at the, I could go get the bottle, but I was pretty sure it was. You know, I'm not a shill for a Pet Focus company. I can just tell you, first of all, I did a head-to-head a number of years ago between Poop Off and Pet Focus. I'm not trying to ding the Pet Focus Poop Off is a perfectly good product. I did a head-to-head on bird poops and just found that Pet Focus worked better. But Poop Off is a great cleaner, but it is not active against bacteria or viruses. Pet Focus is. So I use Pet Focus exclusively. It's also perfectly safe around your animals. You can put it on a cloth to wipe things, and you can spray with it. You can spray it with your birds right there. Obviously, don't spray it in their faces, and it's safe. So I still recommend soap and water, though.
Okay. Shelley said F10 is great.
Yes, F10 cleaner also. I know the vets have it. I'm not sure. I'm sure you must be able to get it online as well.
Yeah, and I just bought several gallons of something. I can't remember what it's called.
Okay, so Daniela asks, if I'm servicing my bird while sick, is there no need to wear a mask or gloves? See, the problem with gloves, and you've seen this if you're going out right now, is that the moment you put the gloves on, that's great, but you're going to be touching your face. So as soon as you start touching your face, the use of the gloves is gone, or the utility of the gloves is gone. So sure, wear gloves. Mask, no, the masks aren't needed. Okay, Paula, what we use here is veterinary medicine viruses is Virkon. So Paula, you're talking about treating the birds. Right now, there isn't any antivirus medication that will treat COVID-19. As opposed to influenza, we do have antiviral medications. Or is Virkon for treating, or is Virkon a cleaner? Oh, for disinfecting services. Okay. I don't know what Virkon is. Yeah, can you look that up, Lara?
Sure.
Oh, I just got extra F10 on Amazon. Yeah, so if Virkon, if it works against viruses, then sure. I'm assuming that is safe around birds. Oh, OxyFresh. OxyFresh, that has bleach in it, right? I'm pretty sure OxyFresh is bleach. You don't want to use anything bleach-based around your birds. Please verify all soaps. Oh, antiviral. Yeah, soap in general. Yeah, yes, all soaps, because soaps, and soaps aren't antiviral. They're generally, a lot of the ones you see are antibacterial, but it's the antibacterial thing that's in the soaps doesn't kill COVID. It's the soap itself. Because soap breaks the shell around the virus. So yes, all soap will do that.
I just looked up Virkon. Several links came up. This is one called Virkon S. Is the breakthrough disinfectant formulation that defines on farm biosecurity with powerful proven performance against over 500 strains of viruses, bacteria, and fungi.
Okay, well, that certainly sounds good. The only thing I don't know is whether it's safe around birds or not.
I
Do you
know it.
know anything about that, Paula, if it's safe to use around birds? Oh, said to be safe around. Okay. Eva, which post was that in response to?
Yeah, Eva, what are you responding to? Who are you responding to?
Oh, is that about the OxyFresh? Used for clean PDD areas, said to be safe around birds. OxyFresh said to be safe around birds. Okay. If you know that to be true, that's a good thing to know. Just remember, a lot of times it's not necessarily even the actual substance, but how it's used, whether or not it's sprayed or whether you just put it on a cloth. Anything that's aerosolized, you have to be really careful about. Things are usually much more safe if you can put it on a cloth and use that to clean something. But I certainly wouldn't use anything that's bleach based close to where birds are. Another thing, oh, buy from my van. Oh, okay. So I must be thinking, I think I'm thinking of the laundry stuff. Is OxyFresh, what's the laundry one?
That's
That's
what I was
oh,
thinking.
is that OxyClean?
Clean.
OxyClean, I'm sorry, OxyFresh. Okay, it's a different thing. Then that's probably good. OxyFresh concentrate. Okay, that's a good, absolutely good thing to know. Another thing, by the way, that can be done is if you have the carriers in another room or another cage, you could take the bird, put it in there, so the person can remove the bird, then clean the original cage, and then put the bird back in there. So that would also help cut down on things.
I just bought 4 gallons of chlorhexidine. Do you know anything about that?
I know, I'm pretty sure, is that, oh no, yes. Yeah, that's the one I'm thinking of. That's the one that after I have my dental surgeries, I'm always having to gargle with. I'm not sure. I'd have to look it up.
Okay.
I don't know if it's bird safe off the top of my head.
Okay.
But again, you know, soap is probably the best. Soap is vericidal for COVID-19. So you really don't have to do anything fancy. You can literally just soapy water and put it on a washcloth and clean with that.
Okay. Okay.
Also, I should talk, you know, I normally kind of downplay HEPA filters because most of the time we don't need HEPA filters for things. This is one case where HEPA filters might help clean the air if you have a lot of it circulating. Again, it's not going to make your home a clean home, but it might cut down, if you have a lot, particularly if you have a bunch of sick people in the house, might cut down on the amount of COVID-19 that's floating around in the air.
Dr. Hopkins, I just wrote down some things you and I were talking about in our emails. Oh, people are asking more
Oh,
questions.
yes, right. How long do you have to scrub a surface with soap? 20-second rules. You actually, I mean, 20 seconds is always great. If it's a hard surface, it's going to be much quicker than that. The reason we say 20 seconds for hands is because our flesh is really good at holding on to COVID-19. So 20 seconds is a good idea to actually make sure you get in all the nooks and crannies and kill it. But if you had a hard surface, like a kitchen counter, just going over it with soap and water is going to be enough to kill it. But nothing wrong with doing 20 seconds on everything. And Paula says Virkon safe used in poultry industry and budgie bears too. Okay, fantastic. So we're getting some lists of items here, which is really great. Okay, chlorhexidine is bactericidal, not viral. Okay, thank you, Colleen. That's really good to know.
Yes.
Bactericidal is not going to help you here, only virucidal. COVID-19 is a virus, not a bacteria. Okay, thank you, Colleen. Heather, how long would COVID-19 virus remain in your bird if you had it touch your bird and transfer your feathers? Yes, so that's, you know, don't know the answer to that. Feathers are a soft surface, so certainly within a day or so, it's going to be gone completely. The odds are going to be highly low that, I mean, very low, that person's going to touch a bird feather and get it from a bird feather. But if it's been less than a day, I'd recommend if the person's just transferring the bird to another container, I'd have them put on a pair of gloves, have the bird get on there, move the bird to the other home, carrier or cage or whatever, and then they can take their gloves off. So, because once they get the bird on there, they're probably not going to be touching their face. So I would recommend that. If the bird's been in the house for a couple of days before someone comes in, then you don't need to worry about that. Can natural sunlight sanitize objects? No, the sun is not going to break open the viral barrier, so no. I have seen people talk about UV light. They're putting their phones in to sanitize some stuff. Like if you get a UV box and actually put them in, that will probably sanitize it. But just natural sunlight, no, that's not good enough.
And something I always tell people, which is not going to be as important right now, but it can be in the future, keep your animals used to change. The more they're used to change, stepping on gloves, strangers wiping down cages, strangers handling them. I just got another text. Things are changing so rapidly. Many people are staying home. If you're not staying home now, there's a very good chance you will be soon. Sit down and train your animals. Get them prepared for this.
Right. Absolutely. Yes. I see people that they're like, and my bird has its breakfast at 8:03 a.m. and it has exactly this, and I have to put my bird to bed at 7:47, or they'll get upset. It's like, you're training your animals to be neurotic that way. Keep it loose. As Lara said, in the wild, animals don't have regulated schedules like that, and every day brings new challenges. Our birds are very, very adaptable to change. In the real world, everything is constant change. So that's their natural state. I think we make some of our animals a little bit neurotic in our homes by sort of training them to expect certain things a certain way and schedule. So keep it loose, change things up. They're very adaptable. Your bird is not going to have difficulty doing this. This is natural for them.
Yeah. We've been going for an hour and 20 minutes. I respect your time, Dr. Hopkins. One thing, do we want to talk about one slight thing that we haven't covered yet, and then we'll go ahead and end it?
Sure.
One thing you brought up in our emails that I think is probably pretty important, boarding animals.
Oh, yes. Okay. So you may think you can that's one of your options, is to board your animals either at an animal boarding place, a dog kennel, a cat house, a bird boarding place, or even your veterinarian. That may not be the case anymore. I know already, I can't really speak to the dog ones, but I'm sure that they must have some sort of thing. If your dog is sick, don't bring them to the kennel. I know pet birding places always require these lengthy statements from veterinarians about all the things your bird is tested for that's negative. A lot of veterinarians won't board animals unless the animals are clients of theirs, and even then they may not have room to do it. Again, with COVID-19, things will be much more difficult. I can probably pretty much guarantee you none of these places are going to take your animals. If the reason for that is because you've been hospitalized with COVID-19, they're not going to take the chance. So keep that in mind. You can always question, but if you call and ask them that, they're all going to say no, because they don't want to infect anybody. And so keep that in mind, that if those are your backups, they're probably not going to work now.
Yeah, we need to really be thinking outside the box, guys, because I'm already thinking differently than I was an hour and 20 minutes ago.
Right. And you know what? Tomorrow this may change. And next week, all I can tell you is what's going on as of today. But the things in terms of preparing for someone else to take your animals, that's not going to change. There are just so many things you can do if you think ahead to do these things. And again, people who are living on the edge financially may have difficulty doing any of these things. And businesses are going to go out of business, restaurants, theaters. I anticipate a lot of places that are already on razor thin margins aren't going to make it through this. People, individuals are going to be plunged into poverty over this. People who can't afford to not be at work and don't have paid time off. And even with these new rules coming up that may give people 14 days off, if you're quarantined at home, I'm going to mix these up too. If you're self-isolating at home for 14 days, you're not even sick, but you can't go to work because you've been exposed, that may use up your 14 days. And then what happens if you actually do get sick or if you're exposed again? So a lot of people who don't have a lot of money put aside to cover these times aren't going to make it through. And animal care is going to suffer because of that too. This is going to have absolutely devastating effects on our economy and is really going to change life as we know it in coming months or even years. And we don't know this is going to go away in warm weather because a lot of warm and hot places in the world have it now. So if it were going to go away in warm weather, why would all these hot countries already have it? Then they're saying that maybe it will be better by summer, but we'll get another wave in the fall. If this does confer immunity, and that's the only thing we can hope that it does, then the only reason it might get better is that herd immunity will get to the point where by the time most people have it, then hopefully that will keep other people from getting it. But viruses mutate. That's why you have to get a flu shot every year, because the virus keeps mutating. We don't have one vaccine that covers flu in general. We don't know if that's going to be the case here. So all I can do is try to, talk about ways to keep your animals safe.
I'm sitting here chatting with a few people.
Yes.
Everybody's saying thank you. I want to tell everybody before you leave, share this. Because if you remember Dr. Hopkins talking for the first 20 minutes, some things were extremely eye-opening. There's a lot of misinformation out there, a lot of people causing unnecessary stress to a lifestyle that, hopefully I'm very wrong, is getting ready to get very stressful. So just eliminating the ignorance first and foremost. Be prepared, stay healthy. Yeah, okay, everybody's saying great information. Thank you. And definitely everybody share, okay? So we have obviously we have the internet, so we can keep in better touch with people. We have FaceTime. I'm not allowed to see my mom right now. Anyways, use technology. Don't forget to Clorox wipe your phone all the time. Use your earbuds. It keeps this away from your mouth. Because I can't tell you how many times people touch this. I set it on a table. I throw it in my purse. I'm throwing it on hard surfaces. And then you pick it up and stick it next to your face again. There
are just so many things you can do. Like if you when you go out to get food, if you have Google Pay or Apple Pay or Samsung Pay, use those because they're no contact. Don't touch anything. Don't touch a touch screen, whatever you do. Like you go get blood, anywhere you go, there are touch screens now. Those things are certain death traps. Don't touch them with your hand. If you have a stylus pen, and like I have a regular pen that just happens to have one of those little rubber things at the end. A lot of people have those, or you can get one on Amazon for $6. Use that to touch any electronic surface. And then all you have to do is disinfect that. Don't touch any of these surfaces with your fingers. Elevator buttons, don't touch those. Use your elbow, use clothing, use a stylus pen, something that activates that button. Just try to stay away from anything that you have to actually touch as much as possible, because that's where you're going to pick up a lot of these things.
Yeah, your click list, so you can grocery shop online and have it delivered to your door. But then, I mean, that's eliminating going into public and touching more surfaces, but there's still touching happening there. Oh, wow, this is
I
overwhelming.
know. I know. It's very frightening. I'm frightened too. It's hard to think about anything else with this going on. And people who have underlying mental health issues, particularly anxiety, I can't even imagine what they're going through right now. I know I'm kind of scared out of my mind myself. So, um, and it's only going to get worse. It's not like hiding out in your basement because a tornado's going through. This is going to go on for quite a while. So we have to come up with strategies, stay in touch with people, uh, check in on friends and family frequently, ask if they're okay. Just letting someone know someone's thinking about you can be enough. Oh, any advice for somebody on crutches? Well, obviously no one else is going to touch your crutches. You know, the bottom of the crutches can be a little bit concerning. Like everything else, you just have to wipe it down.
Yeah. Okay.
All right. Well, thanks everyone for coming. I see. The phone. How to effectively disinfect your device, and Lara will post
Yep.
links to this.
Yep. I'll repost all the links. I'm getting ready to end this recording. Give me an hour. And because it takes some time to download and it takes some time to upload, I will post the links that Dr. Hopkins has given us, and some of the links we talked about throughout the live stream.
And can people post additional suggestions to your Facebook page, Lara?
Yeah, once I upload it. Yeah.
Yeah.
And Dr. Hopkins, I'll give you the links to this for you to share wherever
Yeah.
you want to. And this is important. Share away.
I'm sure you all have lots of great suggestions. So we want to see everyone's suggestions. And again, take what you read and hear with a grain of salt. Please, please, please. Go to reputable sources. Don't listen to the politicians. There's so much bad information being said by politicians around the world.
And
this isn't a political issue. This is a scientific issue.
yes, yes. And just, I know you get on Facebook, whatever, there's people saying all kinds of stuff. Sometimes I just have to put my phone down and walk away. Okay.